News Radio 700 WLW.
Well, we know there is a significant part of our population that does not want to get the vaccination. We've tried, or governments have tried, bribing people. That didn't work. There was the specter of the CDC showing up at your front door. That really hasn't materialized yet. There are vaccines available all over the place. You can walk in. We have a farmer's market in the town that I live in, and about a month ago, there was a vaccination table set up. Come on in, get your corn, get your asparagus, and sit down and get jabbed. That didn't work. But there are a lot of people out there, though, that have misconceptions about the vaccine, and I think that's evident. It's not all just drawn along political lines. Listen to this. Northeastern University and Harvard found that 20% of Americans believe at least one of 4 false claims about the coronavirus vaccine. The 4 debunked claims that the researchers asked a national sample of people about were: the COVID vaccine will alter your DNA. The COVID-19 vaccine contains microchips that the government can track people. The COVID-19 vaccine contains the lung tissue of aborted fetuses, and the COVID-19 vaccine can cause infertility, which makes it more difficult to get pregnant. Good news is 40% of the people surveyed do not believe in any of those 4 claims. But why did a significant number of people, 20% of the Americans that were surveyed, believe those things? And why have we hit a wall about getting vaccinated in this country? Standing by to weigh in, we've had the good doctor on our program before. She is a medical expert and a cardiologist. Dr. Fahmi Farah is standing by right now. And Dr. Farah, how are you on this glorious Saturday?
Hi there. I'm doing very well. Thank you so much for having me on your show again.
Yes, it's good to hear your voice again, Doctor. Now, why do you think 20% of the people got at least one of those 4 assertions wrong? That's 20% out of 100, not large, but it's significant. Are people that ill-informed, that stupid, or just don't want to believe?
I think it's a combination of factors. I think the people who are believing in these myths particularly are just not inclined to take the vaccine, and they're looking for ways of justifying why they should not. And I think part of the reason is there's just bad information circulating. And, you know, one of my advice to people of all backgrounds is to take a look at the source of the information, where that source is coming from. There's a lot of bad information out there online. You know, so you really got to take a step back and look at where the information is coming from. So it really is a different mixture of things that's causing people to believe these.
You know, Doctor, I have a cardiologist here in Cincinnati, wonderful doctor. I have a GP like most people do. That's where I went. I mean, I didn't go online. Although I would love people to listen to my talk show and get the best information from that, and generally speaking, we do that here. But I went to my doctors. Should I get this? This is very, very early on in the process. This was like last November and December, before it was available at a wide basis, and both of them said, yeah, well, you don't think twice about it. Yes, get it. I think that's probably still the best source of information for anybody is your doctor, correct?
Absolutely, yes. If there's any misconception or confusion about whether the vaccine is safe or not, the best place really is your doctor.
Go ahead.
Go ahead.
No, it's all right.
Oh, yeah, I was just going to say your doctor is the best place. And if you're wanting to get more information on your own, website is still a good place, but you got to look at the source. Like CDC is a great source. They have a lot of information about the vaccine, the risks, just in general. So that's a good place to get the information from as well. It's just not wise to look at any source online or just listening to other people who may also be spreading not the most accurate information.
You know, one of the things I heard, and I mean, I guess I understood it again early on in the process, is that the vaccine will give me COVID-19, because there have been some vaccinations where you, and not for COVID certainly, where they will ingest dead cells, and they may have been cells that were taken away from whatever the inoculation was trying to do. But that's not the case with this vaccine. They're not shooting COVID-19 into your system and saying, "Hey, you'll build up a resistance and you'll be fine." Totally off base there, right?
Oh, absolutely. Yeah. No, there's no way anyone can get the virus itself from getting the vaccine. It is not a live virus vaccine, so that's not even possible.
You know, the other thing too, and I again, I think part of the problem maybe for this 20% or for the large number of people that have not been vaccinated in this country is there have been conflicting messages even from NIH and CDC. There's just been a lot of information, and some of it turns out to be not true, and a lot of recommendations, and a lot of that has turned out not to be true. But I think one of the things that's out there is, well, I had COVID. I've developed antibodies. And that's true. If you've had it, you will develop antibodies to COVID. Could happen for other diseases, I don't know. But I know for COVID, it's, you know, that is pretty much beyond dispute. I think the problem with that theory is you don't know what the effectiveness of those antibodies are. You don't know how much you have. It's like saying my car has gasoline in the tank, but you don't have a gas gauge, so you don't know how much gasoline you have in the tank. With the same thing with antibodies. You might have them, you just don't know how many you know, how much you have, and it may be different from the guy next door to you, correct?
That is correct. And to add to that, you also don't know for how long those antibodies will last. So it is true that for people who have had the COVID vaccine, they will get immunity for a certain period of time. Typically what we're seeing is 2 to 3 months. And after that, that immunity wears off. And so we've had many patients who we know got reinfected within 3 months of being infected for the first time. So it is not a forever immunity, definitely not from the data and what we've seen so far, typically about 2 to 3 months. So you're absolutely correct. Those who have been infected with COVID-19, they're still advised to get the vaccine.
No, again, everybody is different in how they react to it. I had the Moderna. I had to have 2 separate injections. I did not have any side effects, or very few. I think I might have had a mild headache after the second one, but I didn't do anything crazy beforehand. I didn't do anything crazy right after I got the vaccine, and I had a mild headache. But I think there are a lot of people who think the side effects are going to be as bad as getting it. And again, this is a conversation that's been going on since January and February. Why it's still a conversation, I don't know. But I don't know very many people that were absolutely turned upside down and floored for a week or 3 days or even 2 days or even a day after this. The side effects are relatively mild. That was my experience. What was yours?
Oh, very much so. I received the Pfizer vaccine, and my side effects were very minimal, and it was no more than the flu vaccine that I receive every year. So, and I know that some of the others who have received it, they have had a little bit more pronounced reaction to it. But again, those don't last for more than 24 to 48 hours. And you're correct that the little side effect that you're getting from the vaccine, it should not deter anyone from getting the vaccine, because the side effects and the complications you can have from getting the virus itself is just so much worse. It's far worse, and lingering long. The effects are lingering on for months. I've had some patients who've had it a year ago, and they're still battling the effects of the vaccine, and we don't know when they'll come back to normal life again. So it goes without saying that vaccine is life-saving, and it really is our only hope in coming out of this pandemic in the near future.
Well, then why is it that, and I don't have the statistics from the CDC for today in front of me, but as of the middle of the week, Thursday or Friday of last week, there was only about 57% of the country that has had at least one jab. And the amount of this country that's been fully vaccinated is just over 50%. Why then do we have such a low number? Briberies don't work. We had a lottery system here in Ohio to give away $1 million once a week for 5 weeks to anybody that was vaccinated. That didn't work. Joe Biden made a statement 2 months ago that they were going to show up at your front door and ask if you were vaccinated. That hasn't happened to my knowledge yet, but I'm not sure that would work. Why is it then that we've hit the wall here in the number of vaccinations?
Very good question. It's not a matter of availability of the vaccine anymore. As you've mentioned, we have the vaccine available. It's just very unfortunate that because bad information is circulating around, it's depriving many people from getting the vaccine. It's because people are choosing not to get the vaccine. And as a result of these myths and non-factual things that are going on about the vaccine, a lot of people are choosing to believe those. And I also think part of the reason, which I have heard many people when I've asked them, what is the reason? Because here's your scientific evidence. I'm your physician giving you the explanation. What's keeping you from getting the vaccine? And more often than not, what I get is a lot of people have reservations because this is not fully FDA approved yet. So I really hope that it will become fully FDA approved and not have the emergency approval for too much longer, because that, I believe, will get a lot of people on board on believing the science behind it and the safety of the vaccine.
I hope so, too. Dr. Fahmi Farah, our guest, and we're talking about why there is this reticence and misinformation about the coronavirus vaccine that's out there and has been out there. I don't know whether you saw this week or not, but the Mayo Clinic Health System did a study from January to July, and what it found was, and this may be, this goes back, you said you had the Pfizer, that against this Delta variant, Moderna was 76% effective against the infection, Pfizer only 42% effective against the vaccination. Now, again, this hasn't been vetted. I guess in your industry it's called a preprint study, so it hasn't actually been studied by other doctors, but the Mayo Clinic Health System is top notch, as you and I both know. What did you make of that? And for those that got the Pfizer vaccine instead of the Moderna vaccine, and where they stand right now after 6, maybe as many as 7 months down the road from getting vaccinated, should the people that got the Pfizer vaccine be concerned about this?
I would not say so. So far, as you mentioned, that's a very preliminary study. We really need more data before we can say that the Pfizer vaccine is less effective than the Moderna one. From the earlier studies they've done by Pfizer, and CDC also agreed that it appears to be quite effective, both Pfizer and Moderna, against the Delta variant. Now, as far as the long, how long the immunity will last for either vaccine, we do not know. And it's a very realistic possibility that there may be a booster shot needed in the near future.
Yeah. You know what I'd like? Yeah, I think that's coming. There's no question about it. You know what I'd like to see, and I don't know if it's even possible, but as we, there's some people that just don't like things injected in their body, and that might be a reason for the reticence on a significant amount of people not getting the vaccination at this point. We talked about antibodies earlier in this interview. Wouldn't it be prudent at some point that we do, for people who have had the coronavirus, have a blood extraction and a test that can be done to see exactly what their level of immunity is at that stage? That might be helpful in a decision-making process to get a vaccination. Is that test not available, not prudent, not too costly? Why wouldn't we have that kind of a test?
Very good question. To give you an example, we do have something called titer, level of antibodies that we can test, not for COVID at this point, but we do have that for other things. An example would be hepatitis B. Hepatitis B vaccine it's a long-lasting vaccine, and for healthcare workers, it's a required vaccine. So whenever you go for a privilege to, say, a new hospital, you have to provide proof that your titers are high enough, or they'll make you, get the vaccine. Yeah. So you brought up a very good point, which is cost effectiveness. The reason I brought up hepatitis B is because it's a long-lasting immunity, and so to test, a few people to see their immunity, it is cost-effective. However, for something like, say, the flu vaccine that's ever-changing every year, we have to get the booster shot. It is not quite cost-effective because we know that the immunity diminishes over time. And with COVID, with the massive number of people who are dealing with, it'll be excellent to have that, as you said, to convince the people, to provide objective evidence that yes, even after getting the virus, your immunity has waned. But whether it's cost effective or not, that's the question here.
Yeah. Yeah. The answers to all of your questions in life is invariably money. Dr. Farah, thank you so much for your time. Good stuff, good insight, and maybe it helped the 20% that just had some misconceptions. Thank you.
Well, thank you for having me.